Welcome to today's episode of Talking Tinnitus. We're here with special guest, Dr. Craig Kasper. You're very welcome to the show, Craig. Craig holds a Doctorate of Audiology from the University of Florida. He's the owner of New York Hearing Doctors, and he's previously elected as a Distinguished Fellow to the National Academies of Tinnitus. So thanks for your time today for joining us.
Appreciate being here. Thank you so much.
So today's topic on Talking Tinnitus is tinnitus treatable? So Craig, is tinnitus treatable?
Yeah, despite what some of our other healthcare providers or what the internet might tell us, tinnitus is definitely treatable. There's so many different things that we can do, but it's really important to understand each individual patient and what their needs are before we determine what their pathway would look like to treatment.
Okay, yeah, super. So I think the first major message for everybody is that you may be living with this, but something can be done if you visit a tinnitus expert who's appropriately qualified.
There's always something that can be done. And it's really important to understand first if there's anything medically treatable.
Sure.
So it's important to visit your physician to rule out anything that might be medically addressed. But once your physician has given you the clearance, the next step would be to visit a tinnitus specialist who then can help you understand different options that are appropriate for your particular case.
Sure. So it might be, unique set of circumstances for each tinnitus patient, but maybe what are some of the general treatment options that are out there for people?
Well, tinnitus can be impacted, and it's a symptom of hearing loss. So the first thing that we need to understand is if the individual who's impacted by their tinnitus is actually experiencing treatable hearing loss. So that's one thing that we would want to understand through diagnostic testing. Once we get through and understand if there's any hearing loss, typically there's other things that are impacting the person's tinnitus perception. Things like poor sleep.
Sure.
And sleep quality.
Yep.
Stress, anxiety. Those are things that can impact tinnitus either in a positive or negative way, depending on the person's state of mind.
Okay.
Also, education, understanding what tinnitus is, oftentimes will take the edge off for a lot of patients because education truly is power.
Yeah. Super. So picking up on that thread, I think, a lot of people with tinnitus, they might come to your practice and it might be a realization to them that, I'm not alone. There's a lot of people in the world living with this. So what kind of percentage of people who come in, they might be good with the education and the information and just understanding what tinnitus is versus the percentage of people who might proceed to, some other treatment?
I think every patient could benefit from the educational elements, and that definitely serves as the foundation. In terms of patients that proceed with more formal tinnitus management treatments, whether that's linear, which is one of our more recent additions to our toolbox, I would say about 80% of patients are proceeding with some form of treatment.
Okay.
The other 20%, maybe lower levels of impact of their tinnitus, where education really is enough for them. And then follow-up occurs just to make sure that if there's any other tools that we need to provide to them as well. But what I would say is that typically patients, by the time they get to us, they've been bothered with their tinnitus for quite some time, and they've tried pretty much everything that's out there in the world. Some things have science, some things don't have science behind them. And by the time they get to us, they're looking for some sort of a treatment option.
Okay, very good. And I suppose, a appropriately qualified audiologist who specializes in tinnitus, you mentioned linear, that's a bimodal treatment that's offered. Are there a couple of other things, psychological type of treatments or anything else that's typically offered for tinnitus patients?
In my particular practice, we take a holistic approach to tinnitus care, where we take a look at the technology as the last piece. It's not any less important, but we don't want patients to think that there's just simply a magic bullet that's going to be given to them where it fixes all of their issues, especially when it comes to tinnitus, because it can be complex. And there's other things that can occur in parallel that will exacerbate their tinnitus potentially. So we focus heavily on sleep health. We know that sleep is intimately involved to our perception of tinnitus.
Yeah.
We look at exercise. We know if patients have the ability to get in physical activity, they're getting out of what's going on in between their ears and outside of their head and into their physical body and into the environment, which has been proven helpful for brain health as well as tinnitus. We also talk about the psychology piece, where we know that one of the most effective things outside of technology, cognitive behavioral therapy, is very effective for most patients who are bothered by their tinnitus. And then finally, the technology option. And again, depending on the patient's degree of hearing loss and their motivation, hearing aids might be an appropriate option as long as they're appropriately fit. And then again, the linear device is something that a lot of patients are very interested in now because the clinical outcomes are very positive.
Okay, that's fantastic. I suppose maybe just the final point on this topic is there are treatment options. Treatment options help, but there isn't a cure. But that's not to say that you can't kind of improve your quality of life or maybe decrease how much the tinnitus is affecting you by going to a qualified provider, getting on a treatment kind of plan that's appropriate for you, I suppose.
It is about the experience of the provider, which is paramount. But yes, there are so many things that we can do. We have to determine what the appropriate path is for each patient. And as you just said, the most important thing that we consider when we're working with any tinnitus patient is quality of life, because ultimately tinnitus is a symptom that impacts our quality of life significantly. And what we've seen when we work with patients and they are consistent and they're committed, their quality of life improves.
Very good. Thank you so much for your time today, Craig. I think like most kind of episodes of Talking Tinnitus, we say the best possible thing somebody can do is to go and talk to a certified, trained tinnitus expert, and everybody's experience with tinnitus is a little bit different, but they'll get you on the right path. And tinnitus is, in fact, treatable.
100%.
Great. Thank you so much.
Thank you.